Mexico, India and Pakistan have hit record numbers of new coronavirus cases as restrictions ease. It's a similar story in a handful of US states like Arizona and Florida. Beijing has just seen its worst outbreak since February. So are we going back into lockdown? Well, it depends. Take Pakistan. Official numbers have soared. Roughly 1 in 5 of those tested are infected, a worrying indication of both spread and inadequate testing volumes. An already fragile health system is overwhelmed and running out of beds. It's moving so fast, in fact, that the World Health Organization has taken the unusual step of recommending that officials reimpose shelter-in-place orders. Only they've done it with a difference. Mindful of the realities of a crumbling economy, the UN body suggests restrictions be applied 2 weeks on and 2 weeks off. Pakistan has yet to act on the advice, but it's just the sort of flexibility that other governments may have to consider as the pandemic drags on. The obstacles, though, tell us a lot. Islamabad has insufficient testing, detecting and contact tracing, meaning it isn't gathering the data needed to make adequate policy choices. Just as serious is distrust in government, compounded by a lack of cooperation from religious authorities. Communication has been messy, and none of these problems are unique to Pakistan. Another alternative is weekend lockdowns, as tried by the Indian state of Punjab, a relative outperformer. The idea is that it's easy to apply and run over a long period while sparing much of the economy. These adapted lockdowns, described by the WHO, are unorthodox compromises, but they're also the sort of options many more countries will have to consider. Strict, all-out lockdowns become much more difficult each time they're imposed. Household finances are more fragile and populations more weary. This is especially true in economies with large numbers of migrant workers and day labourers. Clearly, lockdowns are no panacea, nor are they the only way to control the virus. Simple measures like promoting cleanliness and restricting large gatherings work, as they have in Mumbai's sprawling Dharavi slum. Still, lockdowns are a key tool in the global kit to tackle a pandemic that may yet go on for months. The only trouble is doing it right requires data, trust and clear communication. That means the states that need lockdown flexibility most may be the ones least able to deliver it.